everyone, so today I want to talk to you about a subject that's a little bit taboo for us ladies. It's not something that I think is spoken about enough, and it's something that a lot of us will get embarrassed or scared about because we don't seem to, as a collective, talk about it very much, and that is smear tests or cervical screening. Now this week it is Cervical Screening Awareness Week, so I thought it'd be really fitting to share with you my experience through having my first smear test. So please note that this is purely based on my experience with the whole thing. I'm not an expert, I have no kind of like expert knowledge on the subject at all. I thought it would just be quite nice from one woman to another to share an experience, so there's just a little bit more kind of connection out there really. So if you are from the UK, when you turn 25 you will receive a letter from your GP inviting you to your first smear test. Actually it might come through the NHS, but either way you go to your local GP to have the smear test done. Now when I first got my letter through, it kind of freaked me out a little bit and I ignored it. I just didn't go, which in hindsight was really silly. I waited until the beginning of this year to go and get my smear test, and I went and had my smear test. So first and foremost, when you first receive your letter from your GP or the NHS inviting you for a smear test, go. So the actual smear test. Now I'm not going to lie, I was absolutely petrified to go and get this done. It's the least ladylike thing ever really, isn't it? Just sitting on a bed with your legs open, having a random stranger have a look at your vagina. I mean, I'm not particularly comfortable with my vagina on the best of days, so I don't really want a stranger looking at it. And yeah, I freaked out a little bit. I suffer quite badly with anxiety, so I was really worried about it and got myself into a bit of a state beforehand. And I was seen by a nurse, and she explained to me exactly what was going to happen. So she explained that they would do some checks on me, so they'd ask me a few questions, they'd take my weight, my blood pressure, things like that, and then they would ask me to go and get undressed from the waist down and lie on the bed. And when I was ready, just to give her a shout and she would come in. Now they use a little contraption that kind of opens up the cervix so that they can get a little swab, and they just use it's like a really soft headed bristle thing that looks a little bit kind of like a toothbrush almost, but the bristles are like so soft. The lady actually made me feel them. They're like really silky, and so they insert that and just give it a little twist around to just get their results. And then what they'll do is they'll send them off, they'll be tested, and then you'll get your results back to let you know what happens next. Now a smear test, I'm not going to be light-hearted about it and say that it's a breeze. In terms of if you're an anxious person, there is going to be that worry. In terms of if you find any intimacy quite uncomfortable, then this isn't going to be a very enjoyable experience. But all I can say is that the uncomfortable, awkward, stop staring at my vagina 30 seconds is so worth it for potentially saving your life, because ultimately what cervical screening is to make sure that your cervix is okay and that you don't have cancer. By doing this, you're putting preventative measures in place to make sure that you're the healthiest that you can be. And yeah, it might not be great for some people. It was actually fine for me. I had no problem whilst I was in there. It was a little bit uncomfortable, a little bit embarrassing, but once it was done, it was fine, and there was no pain for me whatsoever. I'm not saying that it's completely pain-free for everybody. Everybody is different, so there is a risk that it might hurt, but it's not going to be to the amount where it's not worth going. Yes, when your smear test is done, it's about 3 weeks before you receive a letter through from the hospital advising you what your smear test shows. Now, my particular smear test came back and I had abnormal cells. There could be two different types of letter. One will be the all clear, saying that you need to just wait 3 years until your next smear test. The other one will be saying that you have abnormal cells and that a biopsy is required. Now, I personally had HPV, which is the human papillomavirus, which is transferred through sexual intercourse but isn't a sexually transmitted disease, which is a little bit confusing. Basically, every woman will probably obtain HPV at one point in their life. It's basically just like the flu for your vagina, for want of a better word, but there are pretty much no symptoms, so you wouldn't know you had it if you did, and 9 times out of 10 it will clear up on its own. It's just a very simple thing, but if you do have it, then it can increase the risk of you getting cervical cancer. And I also had medium grade dyskaryosis. Now don't quote me on that, I'm not sure if that's how you actually say it, but basically what that means is there had been changes to the cells on my cervix. The letter that I received from the NHS scared me. They didn't include any information on what HPV was. They didn't really explain very in depth what medium grade dyskaryosis is, or whatever it is. And so I received the letter and I cried because I was scared and wasn't really sure what was going on. All I could really gauge was that I had something wrong with my vagina and it needed to be fixed, and that's not a great letter to receive, so I was a bit upset. I did a lot of research on the internet, and I did feel a little bit better once I'd realised that HPV wasn't really anything to worry about, and that the medium grade cells that were abnormal could be fixed. So that meant next was that I had to go back to the hospital this time, and they were going to take a biopsy of my cervix, so where they could see from my smear test that there was HPV and abnormal cells. They wanted to test those abnormal cells to see how bad they were, how advanced they are, and exactly what they need to do to treat them, and they pre-booked that appointment for me. So I just got a letter through saying this is what you've got, and then a separate letter at the same time saying this is when your appointment is. So I went back, and they had like one of these chairs that is like specifically for women who need to show doctors their vaginas, which was great. It was super comfortable, and they basically have leg stirrups in them so that you can kind of like slide down and be comfortable enough to have your legs open essentially. Basically what they did, it was the same as the smear test in terms of they used a similar contraption to open the cervix, and then they insert like a tiny little camera, and there's a screen that comes up next to you. Now I didn't want to look at the screen because on the screen is what they can see inside you, which is your cervix, and that kind of thing makes me feel a bit squeamish, so I was like, I don't want to see that, I'm just going to look away. There was another nurse that wasn't examining me holding my hand and talking me through exactly what was happening and what was going to happen next, and etc, etc. And basically she just had a look, she put some like an iodine solution she sprayed all over my cervix, which I couldn't feel, and basically on the screen it would have showed where the abnormal cells were, and then she just asked me to cough while she just like kind of, I want to say pulled, I'm not actually sure what they did, but they just removed a bit of my cervix, like a tiny little bit, to send as a biopsy to test how advanced or what the level of my abnormal cells were. Once that was finished, it was quite uncomfortable. So a smear test usually will be pain-free depending on the person. The biopsy is a little bit more invasive, so it's not as comfortable. It's not, I mean, I say not as comfortable, it's just a little bit more uncomfortable. You might get kind of like a little bit of a dull ache at the bottom of your belly, like a period pain, that will last maybe a couple of days. They do advise that you bring some sanitary towels with you, or they do have them there, because you might, because they've kind of essentially taken some bits off your cervix and used a solution on your cervix, you might get some kind of like muddied discharge that will just be a little bit unpleasant, so it's safe to wear a pad for a couple of days. I actually took the rest of the day off because I wasn't really sure what to expect. I was feeling really worked up before I went, had a little bit of a cry after it was done, and I just felt a little bit kind of violated. It's not the nicest experience to go through, and I just really kind of wanted to know what was wrong with me. So I took the rest of the day off. I rested with a hot water bottle and just chilled out, and it was fine. Like, I was okay. I just felt a little bit achy and a bit shaken up. And with regards to the HPV virus, but they do now do a HPV injection for younger girls. I think it might be for schoolgirls, just to kind of avoid you like getting it, just like a flu jab essentially. So for the younger ladies out there, if you're watching, it's probably definitely worth having a look into that, just to see if you could get that done to avoid getting HPV. So then I went away to Bali, and I knew that when I came back I would have the results from the biopsy waiting for me. What my results explained was that there were 3 different levels of abnormal cells called CIN1, CIN2 and CIN3. CIN1 is 1/3 of the thickness of the surface layer of the cervix. Number 2, CIN2 is 2/3 of that, and CIN3 is the full thickness of the cervix layer. So that basically just means the surface layer of your cervix has abnormal cells on it, and CIN1 to 3 is just how kind of like embedded they are into that surface layer. So CIN1 is the like kind of like least invasive, and the 3rd is obviously a little bit more advanced. My biopsy had shown that I had CIN3, so the whole surface layer of my cervix was CIN3. And that I would need to go in for a treatment, which was done under local anaesthetic, so I'd still be awake. It was called a LEAP procedure, or a LETS procedure. They use a thin low voltage wire loop to cut away the abnormal tissue. So as you can imagine, not too pleasant. Again, the letter was very basic. It didn't explain what CIN1, 2 or 3 was, so automatically I freaked out. It basically just said CIN1, 2 or 3, CIN1 is the kind of like the least advanced, CIN3 is the most advanced, and you have CIN3. And I was like, great, what the hell is that? So I had to Google again what all of these things were and what they meant, and had a little bit of a mini freak out. And then I obviously had my appointment booked in to go and have it done. This time I decided to take my mum with me because I knew that it was going to be a little bit more invasive than any of the other things that I had experienced. The procedure means that you can't use tampons or have sex for 4 weeks. You can't like have a bath or go swimming or anything in that period too, because essentially what they're doing is burning off these cells, and then they've got to give them time to heal. And so I went to the hospital on my date that was given to me, and I got undressed, got in the chair, same as last time, same chair as the time that I had my biopsy, same ladies that were doing the procedure for the biopsy doing this one, and they did exactly the same thing, put the camera up me to see like, and put the iodine solution on, and then the lady looked at me and said, no, can't do that. And I just looked at her and burst into tears, because I had worked myself up a treat, like getting myself there with my mum. I was really worried, really nervous, and the fact that she just was looking at my vagina and then looked at my face and said, nope. I was like, what do you mean no? Like, I've had to wait 4 weeks for this, and here I am, and you're telling me now that I'm on the bed with my legs open that you can't do it. Like, what is that about? And she basically said that normally if this is your cervix and then the cervix opening is like here, the normal cells are normally around like the opening of the cell, but basically what had happened is mine had gone like a bit further out, so they were higher up and closer to my vagina wall. And she basically said that it was just a little bit too advanced for them to do whilst I was awake. So she said if she gave me local anaesthetic, I would probably still feel it, and it would be very painful. I asked her why that didn't show in the biopsy, and she apologised and said they're not sure why it wasn't picked up, and these things happen. And I was like, that's fine. Obviously it's a bit annoying because I've worked myself up to get here, and now I'm being told that I can't have it. So they sent me down to pre-op straight away to have all of my like checks and stuff to make sure that I was fit for surgery. And then they said that they would be in touch with a date for surgery. So I went back to the hospital again with my mum. I had to be at the hospital for 7 o'clock. It was the same process as you would with any other kind of operation, that you're not allowed to eat beforehand, you're not allowed to drink beforehand, and all of this information came in a letter to me, and this pack was actually really helpful. It explained what they were going to do in the procedure, it explained all of the things that I wasn't allowed to do, all of the things that I was allowed to do, where I needed to be, when I needed to be there, who I was going to be having the treatment by, what the time frame was, and basically how it worked was I had to arrive at 7 o'clock, and it would be a morning appointment, but it could be any time up until midday, because basically if they had any more emergencies come in, then they would take priority. And I was petrified. I haven't had an operation since I was 4, so I don't remember the whole experience of being put to sleep. I don't like the idea of being put to sleep and the worry that I'm not going to wake up. The fact that I'm an anxious person, like, I think of every kind of possible thing that could go wrong and overthink it. And the surgeon came and spoke to me, the anaesthesiast, is that how you say it? I don't know. And they basically just talked through everything with me, asked me loads of questions, were both very nice and made me feel very comfortable. The nurses were really attentive, like the whole experience was just really nice and calm. I waited until about 11 o'clock and then they took me into a different room to put me to sleep. That was scary, but they were really lovely. The lady held my hand and kind of distracted me whilst the chap kind of sorted me out and put me to sleep. And then it was about 40 minutes later and I was awake again, and I was mental. Like, apparently anaesthetic makes me feel like I'm Beyonce, because I was like loving life and super happy and like carefree and singing and loud, and like nobody else was reacting like this. Everybody else was really quiet. I just couldn't control myself, and mum and everybody else thought it was hilarious. But about after half an hour that wore off, and I felt like I had the worst hangover ever, and the pain kicked in. I had a really dull, full ache in my stomach, like it was like a period pain but worse, and they'd advised that they'd given me some painkillers whilst I was asleep. It like kind of advised me the painkillers that I could take kind of going forward. I came home, went to bed, rested. To be honest, the worst bit of it was the anaesthetic. It just knocked me for 6 and made me really tired for a really long time, like a couple of weeks it took me to get out of it. The pain lasted for about 2.5 weeks. It gradually got a little bit better as the time went on, but it was a kind of constant pain for that period of time. For the first week, I had no bleeding. So basically with the procedure they burn off the cells and then they cauterise the area, so the cauterisation stops the bleeding, but after about a week that cauterisation will come away like a scab, and then you will experience some bleeding, and that is in most cases. That's not everybody, so you could bleed straight away, you could bleed after 3 weeks, you could bleed after 2, you could bleed after 1. Everybody is different. I had a bit of mucky discharge, and that lasted for about a week, and then the cauterized area came away. That was kind of gritty, like it didn't have like a great smell. It was quite like, it smelled like burnt skin essentially. Came away, and then there was bleeding. So for me, the bleeding lasted for 3 weeks. It wasn't particularly heavy, and it wasn't constant. It was more like when I went to the toilet there would be kind of like a load of it that would come. It wasn't the same colour as period blood, it was more kind of like a watery colour. Within this time I did get a temperature, I had hot and cold sweats, and I did think that I was starting to get an infection. I just took a couple more days off work and relaxed, and it seemed to clear up itself. I did ring the Joe's Trust helpline, which I'll leave below. They were amazing. I just called them and they like asked me a lot of questions and basically said it sounds like you could be on the verge of an infection but not quite, so if it doesn't kind of develop within a few more days then you should be fine, but if not, go to your GP and they'll give you some antibiotics and it will just clear it up straight away. So that kind of eased the worry there for me. It got to the end of the 4 weeks and I'd stopped bleeding, but I still was experiencing the discharge that was a little bit ready, and not quite back to normal. At this point you're able to have sex again, which I did, and it was absolutely fine. It wasn't uncomfortable or painful, so I'm guessing everything had healed okay. And then a week later I received a letter from the hospital confirming that they had removed the cells and they'd come back as CIN3, and that I needed to go back to my GP in 6 months' time to have a repeat smear, and then they would take it from there. So hopefully that meant that they had got all of the cells, but if not I would have to go through this process again, but it's only 6 months. And basically with your cervix and with abnormal cells, the changes take years. So I'm 25 years old, 26 next month, and like the lady explained to me that like how far advanced my cells had become would have taken 10, 15 years. So it's not something that happens overnight. So if you get your results and you're worried because you've got to wait 4 weeks for your appointment, or you're not available and you have to wait even longer or anything like that, don't worry, because nothing bad is going to happen in the meantime, unless there is an instance where your biopsy shows that you have cancer. Then obviously they would treat you as a priority patient, and there wouldn't be any question about you getting seen quickly. But with regards to any abnormal cells from CIN 1, 2 and 3, with regards to the mild or high risk cell changes, like, you don't need to worry, they're not going to develop overnight. And I mentioned briefly before about Joe's Trust. They are a website for cervical cancer patients that have an amazing website, an amazing helpline that is there for you to talk about cervical screening, smear test, abnormal results, the Let's and Leap treatment, aftercare. They have forums online where there will be so many questions from other people that are going through the same experience, and then people who have gone through the same experience answering those questions with their advice or what they did or what they didn't do. The main thing I can say is that it is just so important to go and have your smear test, regardless of how traumatic the experience feels, or how degraded you feel, or how unnecessary you think it is. It's totally necessary. If I hadn't have gone and I had left it another 5 years, I could have cancer and not be here. So it's not even a question, like, you just have to do it. And I'm not saying that everybody's going to have a smooth process. I mean, my smear test was really smooth, my biopsy was really smooth, but then from there it went downhill and I had a bit of a crappy experience. But the main thing is that I went and did it, and I'm on the road to like recovery. And the fact that the NHS offer this as a service, I think, is amazing, because it's preventing us losing our life. Although I do think the age should be lowered. I think 25 is too old. I think 21 would probably be a better age. The reason that it's so high is because when we're younger, I believe, we're like our most sexually active, so we're more at risk of having the HPV virus, and with the HPV virus means that you're more likely to need to have a biopsy. So essentially it's a little bit more expensive for the hospitals, because nearly everybody would need to have a biopsy, and although it's better to be safe than sorry, there isn't the budget for everything. So that's what happens, things get knocked on the head and moved down the line. So, but we've got to work with what we've got. And if you are 25 and you are eligible to go, or if you're not 25 and are experiencing anything out of the ordinary, go and see your GP and talk to people, or email somebody that you know has been through the same thing. Email me, talk to me. Like, I just want to make sure, like, that people understand how important it is to go, how important it is to look after your body. And so I will link everything below. I wrote a huge blog post on my experience prior to having my treatment, so I'll link that below. I'll leave all the links for Joe's Trust with their Twitter handle and their telephone numbers and their websites and forums and things. And if you do have any questions, please do leave them in the comments below. And as I said, it is cervical screening awareness week this week, so if you haven't booked it already, now is the time to go and book it. So yes, that is everything, I think, guys. And as you can see, I'm fit and well and healthy and happy, and all we've got to do is just keep pushing on and raise awareness. Like, please, like, share if you need to, if you feel like there's anybody that you know that might need like this little push to get them to the doctors, just to look after their bodies and make sure that they're being healthy. Like, every little bit of awareness helps, and I am really happy that I did it. Like, it was painful and uncomfortable and a bit crappy, but I'm alive and kicking, and that is the main thing. So as I said, leave any questions that you have below. I will definitely answer them if I can, and if not, if there's something that I can't answer, there will definitely be somebody that can help that is a professional. So yes, thank you guys, give it the thumbs up if you enjoyed it, and don't forget to subscribe if you haven't already.